Is Dr. Nazira Dawood, and she leads the Division of Health Promotion at the Fulton County Wellness Department of Health and Wellness. So let me pull her talk up. So please welcome Dr. Dawood.
Thank you so much, Erin. Hello, everybody. How are you all doing? Great. Can you hear me okay? Excellent. So what are the 9 most dangerous words in the English language? 9 most dangerous words. I'm from the government and I'm here to help. That's what Ronald Reagan said. So again, I'm known to go over time, so thank you, Tony, for offering your 5 minutes. Usually my second slide is about acknowledgement and thank yous because I think I cannot do this or we couldn't have done this without a team support. My management, Dr. Harris and Dr. McKenna, my wonderful team who supported me and have been putting up with me for these past 2 years. Our coalition diverse co-chairs, Mr. Rodney Mullins, who's the HPAC co-chair, John Stewart for inviting me to be here, and of course Marshall Kruder, who has helped us connect the dots, and you for being here today. If you can see closely at this picture, you'll see diversity already at work. This happened in January. That is a month and a half back on Martin Luther King Day, where we were able to secure this lot for a community garden, and these 2 kids holding hands, coming together, planting seeds for the future, for the community. And that's what, if you want to ask me to show one picture, that's what I want to show, what we've been doing for the past 2 years. Fulton County stretches 72 miles long. It's very challenging. It has 14 municipalities. City of Atlanta resides in Fulton County. 93% of Atlanta's population is in Fulton County. And as you can see, the leading causes of death is almost the same in Fulton, Georgia, and United States, except it's just flipped over here and there. Initially, when I came to Fulton 2 years back, there was no mission and vision in the health promotion division. So I had a fresh start, which is always good. So we looked at what should be where do we want to go? And we looked at the county health ranking system that's put out by the University of Wisconsin, and we learned we had ranked 26th according to the health outcomes and health factors. So we said, you know what? I know where we want to go. We want to be the healthiest county. So my boss comes and says, are you sure? He said, why not 12th or 13th? No, I said, if we aim high, we'll get there, because I knew I had the support of a great team. I don't have to show or talk about this, but as the bite size and the cup size increases, so is the weight of our nation. Technology has helped us, but also has been not a very good thing, as you can see, because it has limited our activity and our health diet has not been healthy as well. So what do we do with limited funds, right? We have limited funds, but obesity is on the rise. Georgia is ranked 2nd highest childhood obesity in the nation. We said we need a paradigm shift. So health departments are local health departments are known for health fairs. How many of you know that? Right? Anytime you say the health department, oh, they do the health fairs. No, so we changed the paradigm shift. We said, no, we're not going to, at least in the health promotion division. We said we're going to move from health fairs to policy systems, environmental changes. Anybody who interacted with me since then knows my middle name is PSE, which is Policy Systems, Environmental Changes, because I tell them, if you come to me to talk about a health fair, no, I'm not the person. But if you're showing me that the activity that you're leading to is going to lead to a change, then yes, please do talk to me. So we moved from a know-all agency to everyone knows something, to I know all, to you have something. People are tired of needs assessments. Believe me, I know, I've heard for the past 2 years, they said everybody's doing needs assessments. So we need to move beyond needs assessment and find out what are their assets, and then let them give up. Sort of, you're giving them, empowering them to show they are an asset to our community and to our approaches. So from silos to coalitions, that's where we went. So we're all working in silos. Everybody in every sector, that's what we realized, especially the smoke-free efforts, the asthma coalition efforts, the diabetes efforts. We have all the resources in the community. And to bring them all together was the only way to make sort of form coalitions. And this is community driven, community empowered. It's by the community. We are only giving them a forum and the guidance, the TA, to start, to make them empowered to start these activities. So every time it has been always government imposed. No, we changed the approach, like I said, paradigm shift, and showed them, no, you can do it. So all these representations, as you can see in the boxes, the Smoke-Free Coalition, these are the community people. The co-chairs, always a Caucasian and an African American. Always a co-chairs in all our coalitions are Asian or African American, or Asian and Caucasian. So you can see the diversity where I'm coming from. Again, PSE changes. So these coalitions know they have to do PSE. That means sustainable changes. PSE parks, smoke-free parks, smoke-free campus. Actually, we're working with GSU right now to enforce the policy that was recently passed by the GSU administration. And for the Diabetes Coalition, we are trying to address food deserts. We are trying to also, how many of you have heard about Healthy Corner Store Network? Excellent. So we are also working on Healthy Corner Store network on the Boulevard area, where we are transforming the unhealthy corner stores, getting the buy-in from the store owners and the store managers to transform it to a healthy corner store. We are moving from a PowerPoint presentations to power sharing with the community. So the community has really not always heard, it's just like these presentations being offered, but they're never given a chance to come in front and be in the forefront and present to their community members and being empowered. So we're teaching them to make presentations. We're empowering them to take charge because they have the ultimate power. So we formed the coalition, which is called the Health Promotion Advisory Coalition, which we think is a blueprint for health promotion across the nation. And if you look at the board of directors being represented in this HPAC, which I'm calling HPAC, board of directors are Hispanic, an Asian, African American, Caucasian. So you can see how male and female gender represented equally. We have a steering committee. The Diabetes Coalition is 50 members strong. Safe Kids Coalition has been in existence. Healthy Heart Coalition is 60 members, 60 agencies strong, along with community members, all the stakeholders, American Heart Association, everyone you can think of. Smoke-Free Coalition, again, 90-member agency. Again, all of them are working on PSE changes. Asthma Coalition, Interfaith Coalition, Women's Health Network, to bring all of them together. The co-chairs of all of these coalitions formed the steering committee. And ultimately, we formed the HPAC, which involves all the 14 mayors of the municipalities, because we feel these are the grassroots people, the coalitions. The HPAC is the grass top. That is the elected officials who are making the decisions. And so the mayors and the university presidents and everybody's involved, the chambers of commerce, etc. Some of our cool initiatives are, we're becoming from the health educator. Like I said, we have always been out there just giving presentations rather than empowering the community to take charge. So we're moving from health educator to a community resource champions. That means we are educating the community to become community resource champions so they can go educate their members. And we also won the award for National Leadership Academy for Public Health, which was we were one among the 20 teams across the nation. We were able to build the Asthma Coalition because of that public health award. That means not monetary. They were just providing us coaching. We connected the Public Health Center private resources. This poster is very emotional to me. This lady, this small child, Brennan Passons, she passed away October of last year, or 2010. And I keep her picture on my desk. Her mom emailed me today morning and said her daughter who passed away and Sarah are in spirits with us today. So that's her mom over there holding the poster. You can see how we've empowered the community. I feel they are the community to be voice champions, to be the spokespersons. And the African American couple that you see over there are this child, Kellen's mom and sister. And so how we were able to connect both of them to an Asthma Coalition Summit, and they're taking the prevention message far and wide across Fulton County. And if we can prevent another child from dying because of asthma, I think we've done our work. But hearing from Sarah, is if only she knew. That's all she talks about. She's still grieving, but she says if only she knew she had to give an EpiPen to her daughter, the daughter would be alive. So I do have Brennan's picture on my desk. She gives me energy. That's what keeps us going. We became from the boardroom to the boulevard. How many of you know where boulevard is? Excellent, all of you know. So we've passed policy changes already. We've started with Head Start centers. We've implemented the school flag program about outdoor air pollution. And we've gone to Governor Deal's office, but also we've gone to the streets, the boulevard, the people whom you see on the down slides. They are all gangsters. We've become their friends, and we are all gangsters, so don't mess with us. We brought them out of their area of comfort and brought them to screening services. Walter, his name is Walter, very close. Every time I go to the parking, hey, sweetheart. So very, very good friends. They've gained our trust, and so have we. And they never knew there was a health center just 10 steps across. That was the worst part, because we keep saying social determinants. One is access to care. They just had to take 10 steps. The no transportation problem, no mileage problem, but because they were left out of the system, all they needed was to be reached out. And it just took a few handshakes and a couple of smiles, that's all. And pointing fingers to listening, that's what we did. We formed the Interfaith Coalition, comprised of the Jewish community, Islamic community, the Hindu community, and the Baha'i community, and they started focusing on health and prevention. The interesting part with this coalition was we were not speaking the same language. Public health professionals were speaking a different language than the faith community. So when we started the coalition, when we started the vision statement, I said by 2013 we have to do this with SMART objectives. They said, wait a minute, what are you doing? They said we'll have our aim statement. Our aim statement is faith communities united for health. Your body is a temple. So it was just listening to them. We got their buy-in, and they're empowered, and they're making policy changes at this time, community gardens, and also they're passing nutrition policy in their congregation. We came from convention and seminars to corner stores and community gardens. So yes, we do provide conventions and seminars to the community. Also, we did a corner store network survey in the Boulevard community, where we realized that almost more than 60% of the Boulevard community goes to their mom and pop store to get their groceries. And it's a food desert. So how do we address food deserts there? We're starting to build community gardens. And this is one of the community gardens that we were challenged to, but got it finally because the community had the power to make it happen. And moving to the next step from health to our health-onomics. So this is this flowchart is being put together by Rodney Mullins and myself. Rodney Mullins represents the HPAC co-chair. He's the community liaison. So you can see when you work with the community, great things happen. Great things happen. It's just that sometimes they're always left out of our decision making and in our boardrooms. Bring them to your boardroom, and they have great ideas. So. Thank you. So you can see the core. The core is the community coalition, and we are looking at. We went to the Boulevard and we started talking about eat healthy, eat apple, eat this. They said, no, all I'm looking for is a job. So can you see how public health professionals forget the economics part? So talking to Rodney, he was sort of talking with the economic language, and I got interested. Can you talk more? So we combined forces and we said, okay, let's promote this as our health-onomics. And whenever we're giving out the health message, we need to give out the economic message too. So that's the core is, again, the community coalition. They have the power to take this further and help and make it into a healthy school, or either individually being empowered, and also making them into community resource champions, as I said before. Finally, challenges, gaps, and opportunities. I don't know how many of you were here when Sir Michael Marmot came and presented. How many of you did listen to his lecture? Great. I think that was the best lecture I've ever heard. But he says, do we have the knowledge? Yes. Do we have the means? Yes, do we have the will? And someone earlier asked a question, what is the right thing to do? Excellent question. And to do all this, we didn't have any money. I just had 4 staff in my team. But I knew money was not everything. And I knew we had all the assets and resources in the community, just getting them together and making it as a value-added work for them would make things happen. So with $0, we knew this was the right thing to do, to get the community empowered and to be the healthiest county in Georgia. And as you can see from the big picture, it's about getting the community together. Being an Asian, I've heard from both the sides, and it's interesting because racism does exist. I can't deny that. But how do we find the common ground is the answer. Just like as this big picture says, if one is affected, we're all going to sink. How do we all come together? So thank you. That's all I had to say.